Okay, awesome. All right, let everybody put the hands together like this. Come on. Yeah. Clap, clap, clap. Clap your hands. All right. Clap, clap, clap. Clap your hands. I want y'all to repeat after me. Clap, clap, clap. Clap your hands. Okay. Give me an S. You got your S. You got your S. Give me an H. You got your H, you got your H, give me an A. You got your A, you got your A, give me an M. You got your M, you got your M, give me a P. You got your P, you got your P, give me an O. You got your O, you got your O, give me an O. You got your O, you got your O, give me an I. You got your I, you got your I, give me an N. You got your N, you got your N, give me a G. You got your G, you got your G. What did I spell?
Shampooing.
What did I spell?
Shampooing.
Everybody say go shampooing. All right, that's exactly what we're going to do today. We're going to talk about shampooing. Also, when it deals with the care of the scalp. So we're going to deal with the care of the scalp and shampooing. These are going to be some things on how to render services to people who have dandruff, or they might have a very tight scalp that you want to make flexible and loose. Also, different things when our client come in, and we can add on services as well. This is the place where your client feel more strongly confident in you as being a stylist. So we're going to discuss some things when it pertains to shampooing. Now, when you have your client and you all are up front going to the reception area to get your client, and you have that initial greeting, eye contact, making sure that you speak out very clear their name with a smile on your face. A smile has 1,000 words in it. So therefore, you can show that when you go up front, and also with a double handshake. That sets in that confidence. So you actually just shake their hand and make sure you grip the opposite hand that you shake with, and for security. Now, when that client comes back to your station and you have her to sit at your station, in the process of you introducing yourself and finding out what type of service you're going to render to your client, you want to make sure that you properly drape her. When we're dealing with just a basic shampoo, we talking about one towel. Everybody say one towel.
One towel.
So one towel draping for the shampoo, but if we're doing a chemical service, we'll use 2 towels. Everybody say 2 towels.
2 towels.
And so when you're doing one, you want to make sure that you hold it on a landscape. That landscape towel is going to travel side to side. So that will be what? Horizontal, okay? So what I'm doing is holding the 2 upper corners. I'm going to take and drop that bottom top corner and pick up the bottom corner, and I'm just going to secure it in my hand nicely. I want to make sure that I take and wrap it around my client's neck. Of course, this is a mannequin. I'm going to make it tighter, but if it was a client, it would just kind of fold over, comfortable enough where her neck is completely covered. Now, I'm just going to go back with my mannequin and secure it nice and tight so it doesn't fall down. And once I do that, I'm going to take it and just cup it in the inside. Just a nice help to secure. So after doing so, because we're talking about a shampoo, this is a technique that I want to share with you all. When we're looking at how we normally wear our cape, and what we do is we take and we put it in, wrap it around the front, and then we're pinning it to the back. So now there is a big open gap back here in the back. It's optional that you could do it that way. But what I want you all to keep in mind is when that client is at the shampoo bowl, You can also take it and flip it the back side. So when you drape this cape across the back of the chair, it will, that water will do what? Just flow on down, just in case, you know, it gets a bit more wet back here. So I know it can be challenging to not to get our clients wet, but there are different system things that are put in place that can help you to be most effective. So what we're dealing with is making sure that we drape, and I'm gonna have you all to demonstrate these procedures when it deals with proper draping. Now, after we move from proper draping, we want to begin to start investigating our client. Analyzing the hair and the scalp so you can know what type of shampoo you need to use. You need to know what type of services she desires will allow you to know what type of shampoo to use when we're dealing with the hair's density, when we're talking about the hair texture, the hair condition, the scalp condition, all of that matters. So what I'm gonna do is I'm gonna take a look into her scalp, making sure she has no abrasions. That means making sure she has no abrasions. So all I'm doing is opening up her scalp. I want to also make sure that I do not see any pediculosis capitis. So we know that that is called what?
Head lice.
Everybody together?
Head lice.
Okay, so when we are making sure that we don't see any type of head lice or pediculosis capitis in the head, we want to make sure that. Also, I want to make sure that I'm looking for tinea capitis. What is that?
Ringworm.
Okay, so tinea capitis is ringworm. So you don't want any pussiness, ooziness coming out the scalp. So no external parasites, nothing that look like is growing on the scalp. When we're looking at people that have psoriasis, you still can service them, but according to certain conditions that they may have. Yes.
So what if they got like a big old mole on their head? Can you still service them?
Say that what?
Say if they got like a big old mole on their head. Can you still
mole?
Mole.
Mole. Oh, yes. Yes, you can still service them if they have a mole. You just have to be gentle in that area. Those skin tags, they are present like over people's bodies, and it's okay. You just have to be more gentle, okay? So after going through analyzing the whole head, then we'll be ready to move in. And also what we're looking for, that she has like malesthesia. And what is malesthesia? Everybody?
Dandruff.
Yes, it's dandruff. Okay, I have a question. Olivia.
Do we still service them if they scalp is red?
If their scalp is irritated, okay, so if their scalp is irritated, sometimes you could ask questions. Certain type of shampoos you might not use. If they have like red papulas, those are like red little spots in circular patterns, then you know that you can't service them because it's a type of ringworm that's at the scalp area. A lot of times when we're looking at irritation, you don't want to use anything that has any type of menthol, peppermint, tea tree, because it may inflame even more. A lot of times we ask our clients to make sure that if they have these type of conditions, that they need to go and see a physician and make sure that they bring in a doctor's statement that letting us know that it's okay for us to continue with service, okay? Any other questions? Okay, let's move on to the second step. Now that we have a client that has dandruff and she is coming in, she wants to get a scalp exfoliation, what we would do is we would go in making parting at the scalp area, separating that hair as you travel through, you want to make sure you have your anti-dandruff shampoo. You could take it and put it on your finger and oil it to the scalp area only. Because a lot of times when we use anti-dandruff shampoo, most people just say, oh, well, it's shampoo. Just take it and shampoo it in her head or on her hair. But which makes it, we want the most effective. Everybody say most effective.
Most effective.
We want to make sure we do it most effectively. So as we begin, we want to make sure we glaze the entire scalp first. And after you glaze the entire scalp first, and I'm just showing a little demonstration, I had parted down, off center, towards the back, passing the apex, the crown area, and the center of the occipital bone till I reach the nape. And you want all those partings to start from the frontal hairline all the way to the back of the head. Now, after going in, you want to get your toothbrush. And a lot of times, some people say, well, what type of bristles should I get? Should I get soft, medium, or hard? I always say just get soft bristles, okay? Soft bristles, as you're getting ready to go in, you want to make sure that you take circular motions. Everybody say circular motions.
Circular motion.
Circular motions at the scalp. Clockwise, that what you're accustomed to. If you want to go counterclockwise, you can. So I'm going counterclockwise because I'm right-handed. Most of the times when people that are left-handed, they'll go the opposite direction. So I'm at the scalp area, helping to exfoliate. Everybody say exfoliate. Exfoliation helps to stimulate that scalp and clean the scalp as well, removing all the dandruff, helping to the follicle and the scalp to breathe. This is highly recommended for a scalp treatment. Maybe every once a month. You could do, just depends on the excessiveness or the extreme that client goes through. Most clients have medicated shampoos that they bring in. And if they bring medicated shampoos, you can also too take that medicated shampoo and place it to the scalp as well. Another thing that is for you to do is you can use an astringent. You have like sea breeze, you can use that and put it to the scalp as well, or you can mix it in with your shampoo to do so. But when I talk about most effective, when we're seeing this type of service and we're talking about an add-on, this add-on could take you, depending on your area or location, it can be an extra $10 for the service or extra $15 to $20, determining, how much or how big the head is really. Because you think about time is money and money is time, okay? Yes.
How much time should this jewelry take?
Normally, it just depends on the size of the head and how fluent you are. If that client has thick hair, you know that you'll have to take more thinner sections versus somebody that has thin hair. It'll have a tendency to spread a lot more. So it just, it's a trial, and you'll just have to work your way through it and time yourself. So today we will time ourselves in the process to see how long it takes us to do this, okay? So you'll know for yourself that, okay, I know that it takes me this amount of time to get this done, okay? Do you all have any questions about the scalp exfoliation? Okay, all right, so just feel free to raise your hands and tell me something that we talked about real quick. Okay, yes, Jasmine.
We talked about how to exfoliate the scalp to get rid of dirt and debris.
Okay, give her snaps, y'all. Yes. Okay, yes, come on, India. So one of the things that I think I missed out for properly draping is you want to make sure that you're protecting her skin and also her clothes. Okay? Yes, Katrina. Then I'm coming over here.
Exfoliating, part in the midst of the scalp to analyze the scalp and determine the condition before moving forward.
Okay, so we want to analyze the scalp. Okay. Awesome. Yes, yes. Valencia.
We talked about, how it's okay to raise prices if the head is too big, if it's long,
How about that? Yeah, yeah. Good, good, good. Yes, India.
Apply the shampoo always on the scalp and then go back.
Uh-huh. And exfoliate. Yes. Like when we're doing the exfoliation, what type of motions do you want to? Circular motions. Awesome. Anyone else? Come on. Olivia. Then Jada, I'll come to you.
We talked about how exfoliation treatment would be better for how to treat dandruff, dirt, oil.
Okay, good. Awesome. Jada.
When you go in, you can use 1-inch partings, but if the hair is thicker, you can go in and use thinner partings, and if it's thinner, you can go and use bigger partings.
Parties. How about that? Excellent job. So what we're about to do is get started. So everybody give me good jujus. Give me spirit fingers. And at the count of 3, we're going to be like Nike. Y'all know what Nike say, right?
Yeah.
Okay. 1, 2, 3. Just do it. All right. Good. Hit in.